5 years ago, COVID shook the world. And since then, 1 billion people worldwide have come down with the virus and millions have died. Although today it's become more like a bad cold, new research reveals this respiratory virus still may have long-lasting impacts on your heart.
The coronavirus has now entered a devastating new phase.
When COVID-19 swept across the globe, isolation, social distancing, and wearing masks became the norm. Since then, more than 20 million people have lost their lives to the virus. And now a new risk for anyone who has
heart attack, stroke, and death risk.
In a study of more than 250,000 people, Cleveland Clinic cardiologist Stanley Hazen found that the risk wasn't just immediately after the virus runs its course of heart attack, stroke, and death.
People who had severe COVID were at an even substantial increased risk, not twofold, but like 3 to 7-fold.
Heart disease following a COVID infection was true for anyone, even if you don't have any other risk factors of heart disease.
COVID doesn't care if you're a man or a woman, young, old, have disease or not.
What can you do?
So preventive efforts such as vaccines and boosters, we anticipate will reduce your long-term risk for post-COVID cardiovascular disease.
Dr. Hazen hopes physicians will now ask their patients about their COVID history and help protect their hearts as well.
And previous research found that people who have A, B, or AB blood types are more susceptible to contracting COVID. This new study found people who got COVID and have a blood type other than O had a 65% risk of experiencing a heart attack or stroke compared to people who are type O.